John Weitzel, will you please lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good evening, everyone. First item on tonight's agenda is the consent agenda. A motion to approve the consent agenda as presented. Second. Comment or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Dr. Kennedy, medical staff report.
Good evening. On page 22, you'll see the credentials report for August 2015. And this includes the appointments to the allied health professional staff, appointments to the medical staff, both active, and telemedicine privileges, resignations for the medical staff, and the privilege form update provisional that went through. So I would recommend the board approve the credentials report for August of 2015. You're welcome any questions.
A motion to approve the August 2015 medical staff credentials report as presented.
So moved.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Medical staff policy, G17, disaster responsibilities of the medical staff, and G14, conduct.
Thank you. Yes, these are the medical staff policies for conduct on pages 23 through 29, with a very nice summary on page 29. And then the disaster responsibilities of the medical staff. These are routine 2-year updates. There are no revisions to these policies. I welcome any questions, but these are going through with no revisions this evening. So I recommend approval of both the medical staff conduct policy, G14, and the G17, disaster responsibilities of the medical staff.
A motion to approve the medical staff policies, G17, disaster responsibilities of the medical staff, and G14, conduct, as presented.
So moved.
Second.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Thank you, Scott.
Thank you.
Dr. Corley, Olympic medical physicians report.
Good evening. I'm here to request approval on 2 contracts for providers. The first is an employment per diem contract with Jeff Fresh. He is a physician who we interviewed, him and his wife, a few months back for a permanent OBGYN position here in town. She's finishing her residency back east. As you're also aware, we're down to 1 OBGYN physician in our community, Steve Bush. So even though we're aggressively recruiting for permanent OBGYNs for our community, we really need to bring in some bench strength. Dr. Fresh is out of Louisiana State University. He's working as a hospitalist OBGYN there, but has agreed to come work with us about a week a month to give our other providers some relief. This contract is for $1,500 per day. That includes his call time. We will be providing reimbursement for his travel expenses and housing up to $125 a day.
A motion to approve the OMP professional service agreement with Jeffrey Fresh, MD, at the rate of $1,500 a day as presented.
So moved.
Second. Comments or discussion from the board?
Thank you.
I would just say that this will be a big help to the OB program as we continue to work to recruit permanent OBGYNs to join Dr. Bush.
Other comments or questions? All those in favor?
Aye.
Those opposed? So moved. Roll call.
He will be available starting in about January. The second contract is for a orthopedic physician assistant for Meredith Tipo. She has just finished her training program through the U.S. Army. She's now in the reserves, and she trained down in Fort Hood, Texas, where they have an affiliation with Nebraska Medical Center for the PA training. She will continue in the U.S. Army Reserves, and she will join us in roughly 2 to 3 months with approval of this contract. This is our standard APC employment contract for orthopedics. It's for a salary of $94,264, 2,500 CME.
A motion to approve OMP Certified Physician Assistant Employment Agreement with Meredith Keppel, PAC, at the annual salary of $94,264 as presented.
So moved.
Second.
Comments or discussion from the board? Those in favor?
Aye.
Those opposed? So moved.
Great, thank you.
Julie, may I have the sign-in sheet? Okay, this is the public comment section of tonight's meeting. I'd like to establish some guidelines before we start. Please come to the podium to present your comments. Upon arriving at the podium, please state your name and place of residence. Your comments will be restricted to 3 minutes per person. Having said that, who's first on the list?
Dr. Eloise Kalin.
Gonna take you long to get to that podium, and then you get to talk.
Ma'am?
Yep.
Doctor, you can speak from there.
Oh, can I? All right. As long as your microphone picks it up, that'll work. Allowed 3 minutes. I have to summarize. Resolution 488 is stuck in the time warp in year 2000. You harm the image of the hospital.
We can't hear.
You can't hear?
The hand mic?
All right. Maybe I better get over there. My material is before you can write it, so you're not gonna miss it.
It's the audience.
Vicky's gonna try to get you something else.
They're coming with a hand mic.
Like, well, that's meanwhile, and you might want to be looking at those times as we are proceeding along here. I'm trying to finish some time, but it looks like it's working. It is.
It's on.
Am I getting?
Yeah.
All right.
You can start over, ma'am.
You allow me 3 minutes, I have to summarize. Your resolution 488 is stuck in the time warp in year 2000. You are harming the image of the hospital by issuing a statement so obviously out of date and so uninformed. In 2003, Mr. Liskinovich led a parade of doctors to urge the city council use its police powers to fluoridate its citizens. One argument was overloading of the emergency room by dental patients. I would like you to look at the graph, which is item number 1, attached to the handout there. Well, fluoridation has not only not fixed the problem of overload of the emergency room, dental admissions actually increased at the point at which fluoridation was added. It increased relative to other uses since fluoridation was initiated. It was a growth rate in your emergency room load, but the dental group kept right up. And incidentally, this did not happen in the Forks Hospital. The Forks Hospital ratio over the same period with the same economic downturn and problems stayed flat in relationship to the total load of that clinic. So there was closure of the dental clinic. It must have made some difference to how many hit the emergency room, but it didn't reach as far as Forks, so it wasn't that big. Claims that science supports efficacy of water fluoridation to reduce dental cavities can no longer be demonstrated In today's world of fluoride-enriched foods, beverages, and dental products, if you look at the second graph, you will see a picture of the contribution of non-water things in the diet, in the food, and medications. One of the interesting things of the contributors that was not covered in that graph, interestingly, is tobacco smoke. Tobacco smoke, a heavy smoker has been found by EPA to absorb as much in a day as you get in 1 day's allowance of fluoride in the drinking water. All this fluoride adds up. It's additive. Doesn't care whether it came from the Coca-Cola you drank or
30 seconds.
Oops. All right, on to the next. Claims that there's no harm from the addition of fluoride to water went out the window when the epidemic of dental fluorosis was reported in 2007. The harms were expanded on by the report to EPA in 2006, the great big report. Finally, EPA's recommendations to lower fluoride water levels put the nail in the coffin on that one.
Thank you so much, Doctor, for your comments. Your time's up.
Oh, thank you.
Thank you so much. John, who's next?
I apologize, it's Deborah, but I can't read the last name. Looks like H1.
Hi, my name is Deborah Moff, and I'm a certified nurse midwife. I have been in practice 31 years. I work for you all now. For the past 16 years, I've practiced in Port Angeles. I work for OMP Women's Health up there on the 3rd floor, giving prenatal care and delivering babies. I just wanted to say that I'm convinced of the overall benefit to my patients and their future children of community water fluoridation, and I'm concerned about potential detriment if it's discontinued. In addition, as Dr. Corley was talking about the recruitment efforts, I just want to mention that I think it could be a bit of a factor in future recruitment efforts if a physician is considering coming to this town and sees that, oh, just recently we stopped such a strong public health measure as community water fluoridation. I think that's something to think about. And recruiting an OBGYN physician is near and dear to my heart right now. So thank you very much for considering this resolution, and thank you for your time.
Thank you.
Mark Fisher?
Good evening. My name is Mark Fisher. I'm a resident of the city of Port Angeles. I've been on the medical staff here for also over 30 years. And I would just like to thank the Board of Commissioners of Clallam Public Health Hospital District for bringing the issue of support of water fluoridation for your consideration. I'd like to thank you for your support and full support of this very important, proven, long-term public health measure. Thank you.
Next we have Stephanie Noblin.
I'm Stephanie Noblin. I videotape government meetings, public meetings, but I'm not here as part of Public Eye tonight. I'm here as an individual. I make this comment to the members of the OMC Commission to remind the Board of Commissioners that you are publicly elected, 7-member board elected to govern the hospital district's business. But of course you know that. I can see nowhere in your strategic plan where the board's job is to advise the city of Port Angeles on their advisory votes to their citizens. Your job, according to the charter, is to manage the assets and growth of the hospital district. It is not your job as OMC board to endorse fluoridation of the Port Angeles drinking water. Last January, at the Port Angeles City Council, I reminded them during a public comment period regarding the Port Angeles school bond election that it was not their job as city council to endorse that bond issue. At the conclusion of the meeting, they voted not to endorse the bond, but decided that they wanted to support the bond issue as individuals and of the community. They had a right to do that. I remind you the same thing. If you choose to support fluoridation as an individual of the community, I have no problem with that. However, you should not endorse fluoridation as a board. This could subject the board, the district, and even you personally to damage claims if in the future citizens of the community choose to sue over health issues due to fluoridation. This issue is a personal choice issue. The choice to use fluoride or not use fluoride. The choice to put fluoride in my body is my choice. I am there. I am sure that there are many things in the medical area that requires patient choice. Olympic Medical Center puts on seminars on end-of-life choice. That is the individual's choice. So is the use of fluoride. If the board wants to recommend to OMC Foundation that they establish a fund to help indigent families receive fluoride treatment for their young children, choose to recommend something like that. Choose to encourage the Dental Association to do the same thing, or more than they're currently doing. Find another way, but as a board, do not recommend to the Port Angeles City Council to force citizens of Port Angeles to medicate with fluoridated water without giving each citizen informed choice. I repeat, it's not the board's job to endorse fluoridation of Port Angeles drinking water.
Dr. Tom Lott.
Well, I've been on the medical staff here since 1982, so I hope I need no introduction at this point. I just want to, first of all, thank the board for its ongoing support of community water fluoridation, and remind us all that it's now 12 years ago that something really remarkable happened, is that healthcare leaders all around the peninsula got together, went before the city council, and persuaded them to do something we know is very effective elsewhere in the country, here in Port Angeles. And after a lot of work, in May of 2006, we succeeded in fluoridating the water for over 20,000 people. Since that time, none of the dire predictions that were advanced at that time have come to pass. All that's happened is that things have gotten better. And we don't have the money to do comprehensive studies of this, but we do have data that children's health has improved between 2005 and 2010. We're doing that survey again in 2015, so we'll get a progress report on that in about 6 months. It's time again for health leaders to stand up and voice our support for this. The opponents of fluoridation are urging the City Council to revisit this issue and reverse their decision of almost 10 years ago. And that would be a very tragic thing if that happens. So I'm speaking in favor of this resolution. I am urging healthcare workers, healthcare professionals to stand up and make their voices known. And I will point out, just as a matter of fact, there is no advisory vote for fluoridation. The City of Port Angeles has asked me personally to organize informational public hearing to talk about the pros of this, and then the citizens of Port Angeles are going to be polled. An opinion poll will be conducted as to what people's feelings about fluoridation are. Very different than the advisory vote. So thank you for your ongoing support.
Harvey Kalin.
Well, thank you very much. I follow Dr. Locke because I hear many assertions made, but what we've asked for over a period of many months now is that he actually produce the documents that demonstrate the efficacy and the safety that he always claims. And in fact, very directly at a meeting in Cornelius last month, I said to him, put your cards on the table. He hasn't shown it to the public. He hasn't shown it to the city council. I hope he shared something with you. But that's between you and your conscience, whether you in fact are properly informed or not. Meanwhile, I'd like to say regarding this resolution, which urges laymen of a city council to apply what is bad medical practice and even an unlawful for physicians to treat people you have never met, all ages and conditions, no history of physical exam taken, dosage a wild card due to a great varied water consumption and total lack of control of fluoride from non-water sources. No oversight of individual needed or reactions. No ability to discontinue medication for a patient getting into trouble. No informed consent. So if that's what you want to put your name to, that will definitely be a real mark on your name. I mean, that's it. So moving on from there, the best modern study is based on history and detailed examination of 39,000 school children aged 5 to 17 by National Institute of Dental Research, which produced a computer database. The data was sorted and analyzed separately by Brunel and Carlos for NIDR, and by an independent analyst who reported no benefit for permanent teeth. Brunel and Carlos reported in Table 6 that decaying, missing, or filled surfaces of permanent teeth in children with lifelong fluoridation affected 2.79 surfaces, while children living without fluoridation averaged 3.39. One tooth has top and 4 sides or 5 surfaces. A possible benefit of fluoridation is 3.39 minus 2.79, or just 0.6 of one tooth surface. A possible benefit of fluoridation, let's see, okay, the difference is not statistically significant. Thank you very much.
This concludes the public comment section of tonight's agenda. Moving on to old business, we'll go to the administrator's report. Dr. Kennedy.
Well, good evening. I'd like to give an operations update on am I still on? A brief update on several items tonight, if I could. First thing I want to mention is that we are coming up on the date of October 1st. So the long period of preparation for ICD-10 coding is finally coming to fruition. And I will say that OMC is well prepared. This is an organization that prepared to make this change to a new world of coding that has many more codes. It's much more precise in coding and more complicated for getting started. But our organization prepared to do that last October, when it first was said that it would come around and come into being. That didn't occur last year, but this year it is occurring, and October 1st is the date. Our medical staff and other clinical staff are spending a good bit of time preparing for their work in this, and certainly our finance department and health information management system has done a lot of work behind the scenes to ready us for this day. So I just want to mention that that's coming. You'll see people busy with that, and probably some questions will arise, but again, our organization is well prepared. On a second item, I wanted to mention in the world of our quality management system, again, we are pursuing ISO 9001 certification in 2017. Part of that is having policies for what they call the 6 big procedures: document control, records control, what to do with non-conforming equipment, and also preventive and corrective strategies. And then the final one is the area of auditing. The ability to go from one department into another department and look at the work of the department and ascertain, this one's touchy. Ascertain, are we doing the things we say we do in our policies and procedures? Where we've standardized the work, are we following that standardized work that is in play? That's an important part of ISO 9001. It's work that we will progress with as we develop along the way. But on September 11th, we brought in trainers to train 12 auditors for our organization. So that has occurred. And that was a big kind of final piece in the training as we get started on this ISO journey. So I just wanted to let you know about that. The other thing I wanted to mention is our work with the Sheridan Anesthesia Group. As you'll recall, we began working with Sheridan, a national anesthesia group, to provide exclusive anesthesia services here at Olympic Medical Center. Sheridan started with us in May. They incorporated all of the current providers, anesthesia providers, on the medical staff at our request, and have done a very good job of making that transition. Since Sheridan's been here, they've moved a new provision of care into the world of endoscopy for colonoscopies and upper endoscopies and bronchoscopies and several other procedures. It's made just a great advance in the comfort for our patients in the realm of endoscopy. But the other thing I wanted to mention tonight is just the close work with Sheridan. Dr. Pappy's still there. I see Dr. Adley Pappy. He's our Sheridan leader here on site, working with Dr. Matt Martin, our local medical director. And we have several others from Sheridan in the background that they work with closely. But as we move forward in recruitment, OBGYN, orthopedic surgery, new CRNAs or new anesthesiologists and other surgical areas, I just want to reassure you that we're working very closely with our anesthesia team and receiving good support behind the scenes for the work and the mission of OMC. One development that we have underway as we speak is we are interviewing for a preoperative assessment RN. And this is a position that's new to the organization. It's a program that's new. What we want is to have an RN who basically establishes with us a new functionality to assure that patients that are coming to the organization for elective surgery have the information they need, have had the workup they need, all the parts coordinated. So come the day of surgery, the right cardiac testing has been done, the right conversations have occurred, consents have occurred, and information about the procedure and about the anesthesia have been shared and understood by the patient. So we really see this as a patient-friendly intervention and position that we're establishing. It is a program under development. We'll be working with EPIC, our EHR, as we develop this and develop the pathways that make it efficient. But we think it will be a great way of, one, supporting the work of our OR, the work of our surgeons, the experience of our patients, and to assure that all patients that come to the OR are very well prepared and well informed for the surgery they receive at Olympic Medical Center. So I want to let you know that that is underway. That was one of the reasons that we brought Sheridan in, and we're very pleased to see that moving along. Any questions about that? This is the second time. I want to mention our laboratory. As you know, we're in discussion, we continue in discussion with LabCorp, which is a national and regional, very highly qualified laboratory system. So we're in discussion with them and working on 2 contracts with them. One is for some work with laboratory management and equipment and supplies, which will lower the cost of the program for OMC. We're also looking, we're also working on a contract to utilize LabCorp as our reference laboratory. As we've continued on this work, what we realize is the work with EPIC, between LabCorp and EPIC at Providence, is key and may be the time-limiting factor for moving things forward. So later on this evening, Julie Ruckstad, our CFO, will be bringing information to you about getting a LabCorp Providence EPIC interface for reference lab testing going. She'll introduce that tonight. So work continues. On the area of budget preparation, as you know, we are in the budget planning time now, both for capital budget and for operating budget. Our finance department has partners that work with each of the departments very closely to help them with their operating budget for 2016. This has been a very good program that was established a couple of years ago. It has worked very well for the departments to understand their volumes and have the discussions that are needed to predict the volumes and the work of the coming year and what that relates into in terms of the budget. Capital budget wise, we're looking at lots of items. That process has started both at the budget committee, but also with the medical staff, looking at the medical capital items that have been requested as we continually look to upgrade not only the facilities that we have at Olympic Medical Center, but also state-of-the-art equipment in areas such as ultrasound, the x-ray equipment, our linear accelerator in SWIM, and so forth and so on. There's quite a bit to look at. We usually start with quite a list. It always requires some trimming. That takes a lot of careful input, but that process is underway. And what I wanted to point out tonight is some key dates for the board and the public to remember. Basically, as we work this and we begin to present the information to the administrative team, further information to the budget committee and to the board, we will reach a point where we will first be posting a proposed budget on November 2nd. That information goes to the library. Is that also online on our website? Thank you. The second date there is the November 18th date, and that's when we would bring a proposed finished budget to the board for potential action, potential approval. So I just wanted to highlight those dates for you again tonight. Any questions on that? Okay. Well, I think as you know, we have several OMC representatives over in Washington, D.C. today. And I'll flash forward to a picture here. This picture, I believe, was from today. You see some people you recognize: Commissioner John Nutter, Eric Lewis, our CEO, Maria Cantwell, Senator Cantwell, and Jennifer Burkhart, our legal officer here at Olympic Medical Center. So the OMC team has been over there basically on an advocacy role to meet with Senator Cantwell and with Senator Kilmer's office, as well as other state representatives. And our focus in this visit is it's Rural Advocacy Days. That's what brings folks together. But the message we really want to get across again and again, and we're fortunate because we do feel like our senators and our state representatives are listening, but the message we want to get across is that Olympic Medical Center as a sole community hospital, a level 3 trauma center, a hospital that sits in a geographically isolated area that needs to be ready to handle 24/7 operations of the emergency room, the obstetric center, the hospital, and now really 75% of the outpatient work, the work of the medical center is outpatient. We really are a different entity and an important entity in the United States, an important entity in Washington. There aren't that many of us in each state, but we do need to be recognized for what we do and the value that the medical center brings to the community and the networking with the community as we enter into conversations, discussions, and contracts with entities like the behavioral health system at Peninsula Behavioral Health, with other healthcare entities like Jamestown, Slalom, and others. We recently signed memorandums of agreement with the new federally qualified health clinic that's being established here in Port Angeles called the Ortho Healthcare Network. So OMC has an important role to play. It's important that our senators and representatives understand the importance of not cutting the legs out from under an organization without understanding what they're doing. And specifically, we want to remind them that going to site-neutral payment would be a devastating thing for this community if that occurred at OMC. So we've got a good group over there. Looks like they're having a good visit, and we were fortunate that they were able to meet with Maria Cantwell this week. I do want to mention that we have a medical office building groundbreaking on September 22nd, so that's coming up soon. It'll be at 10 a.m. on the corner of Grace and Georgiana Streets, and there'll be a small reception after that here at the hospital seasonal cafe, and the public is invited. So now, any questions on that?
When is the ceremony for the family medicine? Is that on Monday?
Actually, I don't know if there's one for the North Olympic Health Center. I'm not aware of that. Tom, do you-
Monday, starting at 4 o'clock.
That's okay,
Thank
thank
you.
you.
Oh, good. Yeah, and the groundbreaking here for the new medical office building across the street will be on September 22nd. Okay, thank you. Well, now I'll move to the second part of my portion up here. As requested by the board, Resolution 488 would reaffirm its support of community water fluoridation efforts in the Olympic Medical Center service area. You'll find that resolution is on page 31 of your booklet. And we were asked to bring this to the board tonight for your consideration.
A motion to approve Resolution 488, re-endorsing the fluoridation of the public water supplies within OMC service area as presented. Second. Comments or discussion from the board? All those in favor? Aye. Those opposed? So moved. You're still up, Scott, for North Olympic Healthcare Network revised recruitment agreement.
Thank you. This is for Dr. Jessica Caldwell's agreement. Dr. Jessica Caldwell was recruited to the new North Olympic Healthcare Network Clinic, and Dr. Caldwell signed back in 2014. So she signed prior to the other 4 physicians who have been recruited to that clinic during a similar time period. She starts this month at the clinic. So what we're asking the board for tonight, what we want to do is we want to right-size her contract agreement with the effort. She has been recruited here. We want to retain her in the community as well. And this is what we've done with the other physicians in our support to this clinic system in recruitment. And that is to include a retention stipend of $15,000 per year, awarded annually for a year completed for a period of 4 years. So I would recommend to the board tonight that you approve the revised provider agreement that we have for Dr. Jessica Caldwell to include that retention stipend as described.
A motion to approve the revised provider recruitment agreement with North Olympic Healthcare Network with Jessica Caldwell, MD, to include a retention stipend of $15,000 per year for 4 years as presented.
So moved.
Comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved.
Thank you.
Port Angeles Medical Office Building change order. Julie?
Good evening. This is for the Port Angeles Medical Office Building, which has begun. We have a change order in front of you. Due to a tight schedule, we are asking for a motion from you today. The total change order is for $62,604 for Olympic Electrical, $26,370 for Direct and Direct Construction, and $17,300 for Corley. This is for a total of $106,274. The entire process is for earthwork for electrical cable and phone line burying.
Ready?
Yes, I am.
A motion to approve the change order with Carleen Bensen for the Port Angeles Medical Office Building project of $106,274 plus tax for electrical and earthwork to bury wires as presented.
Second.
Comments or discussion from the board? John?
Question. Since this is a change order, clearly this was not anticipated. So what happened?
What is bringing this?
Yeah.
We have it in the budget for all of this work to be done. The budget we have and is 420,000. This change is bringing it sooner and being done faster and cheaper by going this route. This was brought up to the budget committee last week, so we think it's expedient to do it now with the current contractor while they're moving the dirt. So it was, we thought we'd do it later, and it was already, it's in the contract for a different method, but this is sooner, faster, cheaper.
So basically, equipment on site, ready to go, and cost-effective solution.
I do believe the overlying comment from the budget committee was faster and cheaper is better.
This is what they said, yes.
Thank you. Other comments or discussion from the board? All those in favor?
Aye.
Those opposed? So moved. Pulmonary medicine, revised compensation, Julie?
Yes. Currently, we have a pulmonologist who is at a board-approved base salary, which is based on 2010 numbers. We look at all of our salaries every 2 years, and we haven't done this for a while. And the last 2 years, we've been having a very difficult time recruiting for pulmonologists with critical care expertise, which is what OMC needs. So what we'd like to do is revise our current salary to our current pulmonologist to bring it in line with the latest data, which is 2014, published in 2014, at 25th percentile for 317,548. So it's an amendment to the current contract.
To amend the OMP employment agreement for pulmonary medicine with Raj S. Diol, MD, to the base salary of $317,548, which is at the 25th percentile for pulmonary and critical care as presented.
I'll second with a question.
Yes.
We currently have 2 pulmonary physicians here. Will that change for them also, or will that come later at a different time, or what? One's a hospitalist, one's a
Yes.
private practice. Sorry.
Are
No offense,
they
they're both
looking
here.
at me now? Yes, we will make the necessary arrangements together. This one is coming before you because it exceeds the amount, the contractual amount is over the 50,000, but we can make the other amendments within the already approved model. Yes.
Other comments? Scott?
Could I just make a comment? We've been recruiting for several years for pulmonary medicine here at the center, and we know the need is great. We have pulmonologists that are traveling to Fort Townsend and providing some services there. Our pulmonologists are extremely busy. We need, so they don't have the capacity that the community needs at this point. We've been working on recruiting, but we haven't been successful. We thought we would land a very good candidate who worked with us a little bit and had a chance to try it out and actually liked OMC. But we realized we lost that candidate and received valuable feedback, and that was, we really were not in the market for salary for pulmonology. So that's the basis for this. We have tested the market. We've been unsuccessful with the level that we've been at. Even the candidate that we thought was coming, we learned there was a real reality check at the end of that. And so I really strongly support moving in this direction so we can be successful with recruiting this critical clinical capability for the community.
Comments from the board? All those in favor?
Aye.
Those opposed? So moved. Julie, yourself with an intro with LabCorp Reference Lab Interface Change Request.
Yes, this was referenced by Dr. Kennedy just a little bit ago. We are looking at a change order with Epic. This is to be able to send all of our reference tests out to LabCorp but currently we do not have an interface from LabCorp to Epic and to Beaker at the hospital. So it's a sort of a three-way. And I will bring this back to you at the next board meeting. A total amount that we have is for $96,000 for the interface work. Thank you.
Thank you.
Question, please.
Oh, yeah, sorry.
Just because I'm interested, you don't have to answer it, but how is this whole arrangement with Providence and our own people working in terms of cranking out software?
Overall, there's been huge improvements as we work together and get to know each other. Are you talking about just Epic in general, or specific to Lab?
No, not the last.
Okay. So we have many groups. We have clinical, various different modules. We have our what we call CTs, our credentialed trainers that train people as they come into the different modules, starting from registration and admission all the way down to billing, but in between we have all of the clinical folks. We have a physician trainer, Dr. Stafford, who does all of the physicians as they come on board. Dr. Fisher is here. He's part of the EHR team, which is Dr. Stafford, Dr. Fisher, Sean Marilyn, myself, and Debbie King, and we meet regularly to go over all the modules and things that are going on. There's a continual movement and improvements, some more than others, and some items that we continue to work through. Anything you want to add, Dr. Fisher?
Sure. No, I think I would just echo what Julie said, and also just maybe underscore the continued richness of interaction that we actually have with, with Swedish and with Providence in the EHR work that we do together, and quite a bit of collaboration, and several examples of which they've actually looked to us for our opinions about improvement in these important programs.
We do bring a lot to the table. We have, as we learn more and more, we've begun to bring value to how we use Epic for the whole entire system.
Yeah.
Yes.
Thank you.
Go ahead, Steve.
Are our work orders down?
Numbers are, but they're way down. We looked at our tickets weekly, but they're very. The biggest ones right now are home health because it's the latest. They just came online, and we had some bumpiness because that's what we do. But I think overall, we're dealing with a lot of the issues that we work through, and there are some. We are a beta site for home health, so there are some issues that Providence has to actually take it back to Epic to correct a build or make a radical change. Thank you.
Thank you, Joan.
Thank you.
Pyxis medication system, Lorraine.
Good evening. I'm just here tonight to introduce a request that I'll bring forward in a couple of weeks, and this is for Care Fusion, the Pyxis anesthesia system. And about 15 years ago, we instituted the Pyxis, which is an automatic medication system here at OMC. And over the years, we've added it to various departments, trying to increase the security and the efficiency of use as we dispense medication. And the last area that we have not yet implemented Pyxis is in our OR. And so this request will be for 5 anesthesia machines, and that, as I mentioned, will complete our Pyxis implementation. It is wireless. It helps us with inventory control. As I said, increases security and accountability for medications. And this takes away the manual process that we currently have, which involves paper, a lot of running up and down the stairs and whatnot. So medications are more readily available to our anesthesia providers in the OR. The purchase price for the 5 machines is $116,302.36. And there's also an annual support fee that we would be responsible for, and that's $4,920.
Which year will this be purchased?
We would like to do it this year. There's a lot of organizations that are implementing a newer model, and they're starting with their implementation. So the time frame that CareFusion has actually to provide to us to get the equipment installed is very limited, but they did say that there was a window if we were able to have this approved by November. So we're hoping November, December of this year.
Great. Any questions for Julie? Thank you, Lorraine.
I have a very completely different. Did we get one of the hospitals awarded that?
Oh, the choices, choices. What they said was on September 8th was the deadline to receive all of the applications, so they did let us know that they received the application from us, but they're reviewing it, and hopefully by next week we'll hear that I
Will be held Tuesday, October the 6th at 12:30 p.m. in Swim. And the board will issue a statement tomorrow via our board executive assistant regarding resolution 488 to local media outlets. We will not be making any further comments on this matter at this time. Thank you. The meeting is adjourned.